If you are a woman in your 30s and 40s, or you know and loved one, this is a story you really can't miss.
More women are being diagnosed with oral cancer, and more often, doctors don't know why. NBC 15's Sarah Carlson has this alarming story.
28,000 Americans will be diagnosed this year with oral cancer. 1 in 4 will die. But unlike other cancers we hear so much about, the survival rate for this is not improving.
We really weren't sure if I was going to live to see the next 5 years.
Eva Cohen was only 31 when her dentist found something unusual in her mouth and diagnosed her with oral cancer.
Here I am. I was 31 years old. I didn't smoke. I didn't drink.
The typical patient used to be an older adult male with an unhealthy lifestyle. Not anymore. Dr. Kammer from Madison Center for Cosmetic Dentistry tells us the focus is changing.
There's been a 5-fold increase in the oral cancer incidence of young people, like under age 40, and women as well, with no traditional risk factors.
Survival is only 50% if oral cancer is not caught early. So Dr. Chris is one of only a handful of dentists in our area using new technology to spot it before it's too late.
There's been a movement in dentistry to start identifying and doing everything we can to address oral cancer.
The Center for Cosmetic Dentistry has been using this device, a Velscope, for 2 months. It can find oral cancer early, unlike the naked eye.
Clinically, in the office, you can look with your eyes and look at someone's mouth and see some little spot, or you can't tell a non-cancerous lesion from a cancerous lesion.
Dr. Chris uses the Velscope on every patient in just minutes. Survivor Eva Cohen hopes her story will encourage more dentists and women to ask for this test.
If it can happen to me, it can happen to anybody.
Eva had to have a third of her tongue reconstructed and surgery on her neck. She feared she would never speak or look the same.
I told my children that I was very sick and that hopefully I'll get better. My daughter didn't touch me for 2 years because I really believed that she was afraid of losing me.
Eva is doing well today. She's raising her children and trying to get the word out to other women that oral cancer is something to watch for.
The most important advice is to get to your dentist if you have a sore or lesion in your mouth that doesn't heal in a few weeks. Also, be sure to ask them about devices like the Velscope if you're concerned. The Center for Cosmetic Dentistry will be offering free Velscope exams all this week. That's free. The number to call is 827-6455-FREE. That number will also be on our web channel, NBC15.com. For today's health, Sarah Carlson, NBC 15.
Thank you, Sarah. Another note, Dr. Kammer tells us that there is some scientific evidence that the human papillomavirus, which also causes cervical cancer, may be in part to blame for the rise in oral cancer among otherwise healthy young women.